Good afternoon, everybody. Good afternoon, good afternoon. Give everyone another second to get on. If you have your questions, please send your questions in. Start getting them in now if you have questions about COVID. We're going to give everybody another minute to join, and then we will start with our COVID update for today. Just giving everybody a second to join us. Thank you all for joining us almost every day. I see a lot of people consistently in here so you can get the latest information. All right. So we are going to get started. Thank you all for joining us. It is Saturday, March the 28th. We're going to give you your daily live update from me, Council President Brandon Scott, about COVID-19. We know what's going on. It's a very serious situation, and I'm glad that everyone is staying in the house and joining us today. So we're going to give you the latest updates, and we're going to get started with just the latest numbers. As of this morning, there were 992 cases of COVID in Maryland. There are 112 in Baltimore City alone. There have been 141 in Baltimore County, 196 in Prince George's County, and 255 in Montgomery County. So again, I always take time to say this, that you know that this is very, very, very important for us, and understand that this is a real thing. It is continuing to spread. You can see how important it is for us to practice this physical distancing, because we are not slowing down the spread because we people are not adhering to the advice of the public health professionals and staying inside the house and inside the home. We have to understand that we need folks to listen and heed to that advice. We need that consistently, and I'm going to give you guys a further breakdown too, because I think it's very important for us to have. So we hear consistently about COVID-19 and how it's important for seniors and people with pre-existing conditions. But when you look at the breakdown around the state of Maryland, so again, remember, we had 900 some cases. Of those, 138 cases are from people aged 20 to 29. 174 are people aged 30 to 39, and 204 are people aged 40 to 49, and for age 50 to 59, there's 195 cases. 143 of the cases are in the range where we have been speaking about the most, and that's from 60 to 69, and 91 cases from 70 to 79, and 27 cases 80 plus, 15 cases 10 to 19, and only 5 cases between ages of 0 and 9, 487 female, 505 male. What that means, everyone, is that everyone can contract COVID-19. We have to understand that people cannot say this enough. Everyone is at risk. Everyone can contract COVID-19. This is why it's important for us to adhere to the advice of the public health professionals. And again, we had a live telephone town hall with 3,000 Baltimoreans this week with former Health Commissioner Dr. Josh Sharfstein. And what we learned is that more than anything else, just like I've been saying, it's important to stay at home and maintain that physical distance from people when you must go out, right? One person has the ability to spread COVID to 2 to 3 people. And when you think about all the people you know and all the people that live in our city, think about how serious that is, and how many people can be affected by people continuing to not adhere to this vice. If you must work, you have to change your clothes, take a shower, and wash your clothes regularly when you come home. If you're sick, you should not go to work. You should not go to work. Physical distancing, we learned, is a better term than social distancing, but we want you to remain in contact and keep that human contact with people. So we want you to make plenty of phone calls, send texts, do chats, do group messaging, everything that you do. There are no medicines that are confirmed to work, unfortunately, against COVID-19. Studies are underway, and we'll know more in the coming weeks and months. And then, of course, personal protective equipment is one of the most important ways that we can ensure the safety of our healthcare workers. If you missed this Thursday, we will air live on our Facebook page at Council Press BMS tomorrow evening, the entire town hall. So you get that live tomorrow instead of our normal live. We're going to be re-airing the telephone town hall so that you guys can get the audio and hear what your fellow citizens were asking, but also hear what the public health professional and Dr. Sharfstein is saying about COVID. Just a reminder that schools are closed through April 24th. We know that can continue, and we know they'll be available at 18 city schools. There will be meal sites beginning on Monday, March 30th. Learning packets are not available at Rexenus this week, and learning packets are also available online. You can get the learning packets online at BaltimoreCitySchools.org/learning-packets. That's BaltimoreCitySchools.org/learning-packets. So you can get that information right there as well. But we still are going to continue to have our rec center sites for food in addition to the school system sites for food, so that we can make sure that everyone has access to this much needed resource. But again, all of this information that we're talking about is available on my COVID-19 asset map, which we updated today. You can get that at bit.ly/BeMoreCovid map. That's bit.ly/BeMoreCovid map, and you can get that and see all of the sites, and you can make sure that you get that information and spread it to everyone. Again, remember, no more gatherings of 10 people or more. All non-essential businesses are closed. Utility companies are not shutting off to residential services. No late fees will be assessed on utilities. Only people who have tickets can get into BWI. There will not be given parking tickets for meters or anything like that. But if you do not park in front of a fire hydrant or no stopping zone or in a fire zone, we cannot not have people doing that. Child care centers are closed. As of Friday, all child care programs are now closed. If they do, but there's still cases where they are open if folks are helping people who are essential personnel. You can get that information and see a list of those. We have that information on our web. We're going to put that link in the chat now so that folks can get that. If you are an essential worker and want to know where you can get child care, we'll make sure that we push that link into our chats and in the live feed chat so that everyone can have that. So let's see, what else do we have here? Senior centers are still closed. They will provide lunches though, and remember, we want all seniors to make sure that they are calling 410-396-2273, 410-396-2273. We want people to be able to get that information as well. And just for my staff that are listening, make sure that we put in the link for the eligible programs for child care services for essential employees as well. All right. Supermarkets, right? So we know that supermarkets are providing special opportunities for people with compromised immune systems or pre-existing conditions, in addition to our senior citizens. So food is allowing and reserving seniors and people with pre-existing conditions the chance to shop every day of the week from 6 to 7 a.m. Klein ShopRite, which we have one on Howard Park on Liberty Heights, and there's also another one close to the city on Prairie Parkway. If you live in Northeast, they have waived the ShopRite from home fee delivery, so you can get that on their website as well. Safeway and Aldi have special hours for seniors to shop on Tuesdays and 7 to 9. Dollar General, seniors can shop from 6 to 7 a.m. Target has a special hour for seniors to shop on Wednesday from 7 to 8. Whole Foods will allow shoppers 60 and over to come into the store at 7 a.m., which is 1 hour before opening. Walmart will have special hours for seniors to shop 6 to 7 a.m. on Tuesdays, and BJ's will open daily to seniors from 8 to 9 a.m. Again, this is something I think is critical for us to talk about too. We know that our public transportation is still open. However, if you aren't going to the supermarket or the pharmacy, or you aren't an essential worker, or you don't have to go to work, then you really have no reason to be on there. Safe so that they can get our hospital workers and other folks to and fro to keep us all safe and healthy. We know that we've had a bus driver contract COVID during this crisis. We've had a bus driver, unfortunately, be shot during this crisis. These are the things that we cannot have happen. We have the folks that are looking out for us are the folks that we have to take care of as well, and we have to make sure that we are doing that at all costs, right? And we have to make sure that we are making sure that these people are being taken care of, because listen, you guys, they are taking care of us in ways that we can only imagine doing for other people. So make sure that and when you see them, thank them for their work, thank them for risking their lives for us, because that's essentially what they're doing each and every day, and when they go out. So thank you so much. Let's see, the National Guard. The National Guard, for those who have asked and continue to ask, are here in Baltimore at the request of Mayor Young to only help distribute meals, and they will help him with logistical assistance from our hospitals and medical teams. So, but if you have further questions about that, just give our office a call at 410-396-4804, or you can email us at councilpresident@baltimorecity.gov. That is information that we continuously want to get out to people. So, we know yesterday the president signed a historic $2 trillion economic rescue. Historic plan will offer to tens of millions of American households affected by the coronavirus. It includes stimulus payments to individuals, expanded unemployment coverage, student loan changes, and different retirement account rules, and more. On Wednesday, I actually sent a letter to our representatives in Congress, specifically asking for expanded unemployment insurance for us. I was very concerned about it being 100% unemployment insurance, and including self-proprietors and people who own their own businesses. We know the student loan crisis is something that's very important as well, and we needed direct payments to citizens who are not able to work during this crisis. But this is not over. We know that this bill will not be the last, and we're going to continue to advocate at the federal level for us to see legislation and things that really help places like Baltimore and neighborhoods in Baltimore that struggle the most during times like these. We know how important our small businesses are, and I know how tough a time it is for them. We know that the governor has announced $175 million to assist small businesses and their workers affected by COVID-19. We have that information can be found on the web as well. I will give you the website, and we will post it into the website as well. You can get that website, and we're gonna make sure that we post it here. It's a very long link, but it's govstatus.egov.com/nd-coronavirus-business. That's govstatus.egov.com/nd-coronavirus-business. So you can get all the information for that right there. We're also gonna put that in the chat so that everyone can have that as well. We want everybody to make sure that they have that information. If you work at a small business, make sure that your boss or someone knows as well. The Baltimore Development Corporation is coordinated with the city and the state, and we want to know how our small businesses are being impacted. We have a survey that we're conducting with small businesses, and that can be found at bit.ly/2WC7HXG. That's bit.ly/2WC7HXG. You can find all of that information there. You can find all that information there, and all of that information that we're talking about going out as a newsletter from my office in the next few minutes once the live is completed. So let's see what we else have here. Last thing I'll say before taking questions is upcoming elections. The special primary for the 7th Congressional District. So if you live in former Congressman Cummings District, your election will take place on April 28th by mail. It'll be a mail-in only election, so you guys will be getting that in the mail. Make sure that you are calling the Board of Elections and letting them know what your address is so that they have the right information for you. We want everyone to be able election that was scheduled for the president, mayor, city council president will now take place on June the 2nd. You can find more details about that and all elections at the Board of Elections website at boe.baltimorecity.gov. That's boe.baltimorecity.gov. All right. Thank you for bearing with me with that. I'm going to now move to your questions. And let's see here. So somebody said, is it harder to contract COVID-19 when you're outside? Listen, the reality is that you can contract COVID-19 inside, outside, or in between. It's all about keeping that physical distancing. Think about it. If you can be outside and go to a playground, which you shouldn't be doing. Do not go to the playground. Do not go to the basketball court. Do not go to a place like that. And you can just go and touch a surface that someone else who had COVID touched, and now you have it. And you weren't outside close to anybody or anything. That's why we're going to continuously say, please stay at home and be safe. It's no matter where you are, inside or outside. So I answered the question about the upcoming election. As of right now, it's going to be all by mail. All by mail. So it's going to be all by mail. Also, do you think Baltimore should move to quarantine? So I want to be very clear about that. So we hear consistently folks saying, well, other states have moved their governors and pushed us to a shelter-in-place or quarantine situation. Even in those states, Ohio, California, some of the others, they are still allowing people to essentially do the same things that you can do here today, right? They can go to the grocery store, they can walk their dog, they can go out to the pharmacy, etc. They have basically the same things in place. But also, again, we also have to understand how it's important for us as people to maintain that physical distancing and police ourselves in a sense and make sure that we are telling our friends and family, holding them accountable. The self-accountability during this process is going to be critically important that we make sure that we are keeping our friends, our family, our co-workers, everybody safe. Someone says, when will everything reopen? The answer is we do not know. That's the answer. We do not know. Everything that we do will be based on the guidelines and advice of the public health professionals and how we are doing with this COVID virus, right? virus. That's what we have to understand. This will not be easy thing, right? It will not be an easy thing. We want to make sure that everyone is healthy before we start to open up things. So I know folks have heard the President of the United States talking about opening things back up before Easter. Like I've been saying all week, ignore him and listen to the public health professionals. All right. Are there any plans to move people living in the homeless shelters to hotels? So we're gonna, whoever had that question, if you would send us a direct message, I would to the mayor's plan that he just announced around homeless and what they're going to be doing. I have not been tested for COVID-19 because I don't have symptoms, and I am feeling fine, so I do not. And what they are doing is they are having a focus around first responders and people, especially our first responders who say, they have symptoms or they may came in contact. They're making sure that those folks are getting tested and quarantining them appropriately. Just last night we had to shut down a fire station on McMecken Street for that very reason. So to the person who said do not stay inside, go get outside, listen, we want people to be safe. The safest thing for them to do is to be inside. That's clear from the public health professionals to stay inside. But when you're outside, we want, if you're going outside for a walk or to walk your dog, make sure that you're safe. Make sure that you're sustaining social distancing or physical distancing, as we like to say. We do not want you out touching and playing and all. No, do not do that. Keep safe distance. Make sure that you're being responsible and listen again to the advice of the public health professionals. All right, let's see. Great. So, give me 1 second, everybody. So let's see what else we have here. All right, so let's see. Again, so first responders, they know at work if they make their supervisors aware that they think they have been they may have been exposed to COVID, that they should notify them, and they know there's a protocol in place. So the Eastern District MTA has been reopened. So that is back in operation as of yesterday, I believe. So thank you. We do not have a further update on the first responders other than that they are still in the same situation as before. As soon as we get that, we will make that available to everyone. Thank you for that question. So this is some great info also because someone asked this question about the judiciary. Court orders for custody, parenting time, and child support are still in effect. If you pay or receive child support and need help, call this number, 1-800-322-6347, 1-800-322-6347. If you're in need of protection, your request will be heard. To discuss a family law matter, call 410-260-1392, and you can see the letter from the Maryland Judiciary on my website. So we want to make sure that everyone has that information. So someone asked a question, is COVID airborne or is it caught through contact? Both. They now think that COVID can stay airborne for like 3 hours, and we know it can live on surfaces and be transferred through moisture from people's mouths and bodily fluids. So both is the answer to that question. That's why again it is important for people to stay at home, no matter what anybody tells you. Stay at home. I don't know if you guys been noticing that you've been getting 2 backgrounds from me. One in my office and one here at my home office, because that's essentially the only 2 places that I'm going. Be responsible, everybody, so that we can slow down the spread of COVID-19. And just I will remind everybody that our newsletter just went out, so you can get all of the information from COVID-19. If you direct message us your email, we will send you that and make sure that you get added to the list so that you can continuously get that information as well. Any other questions for everyone? Anybody else have any questions while we're here? It's Saturday, so I got a little bit more time to see if anybody has any other further questions about COVID or anything else that you guys have. Let's see, I think I might have some more information for you guys. Whoops. So I also wanted to mention this. I didn't mention this earlier. Remember the pre-existing conditions that we were talking about? Uh, Again, people who are 60 and above, people who have heart disease, diabetes, lung disease, cancer, those kind of things are pre-existing conditions. So somebody asked a question, it's important for people to stay home. What measures are in place to verify who's out? Listen, we want people to be responsible. Again, if they're not in groups of 10 and more, if they're practicing social distancing or physical distancing, they will not be bothered. The essential who's at work and who doesn't have to be at work. Stuff that we share all the time. You can get that from us again. Make sure that folks know. But there is not a shelter in place right now. So folks they're not required to simply be in the house. What we want folks to do is do the right thing and not go outside. And essentially, when you're in a place where you can only go to the grocery store, or the pharmacy, there's really not much for you to do, right? You can't. We know that we have signs and things, and we're trying to prevent folks from going into playgrounds and basketball courts and things like that. We want people to make sure that they're being safe and responsible. So again, that's why we have that when you go to those stores at those hours, right? And especially the stores where they're open a hour ahead of time for them. That's how you would communicate with them, with those individuals. Uh, So again, for the person talking about the food locations, that's why our COVID map is important. That's bit.ly/be more COVID map, so you can get the information about all of the food sites that's there. It's also there. Yes, Shelly, that's a good point too. I didn't mention that. My brother Shelly's in the comments saying, clean your houses, door handles, all of that, light switches, the stuff that you touch, your computer, your phone, right? Disinfect that consistently, all the time. And yes, it's another great comment there. If you're missing your friends, do social gatherings, do Zoom, Facebook Messenger, WhatsApp, FaceTime. All of these Google updates. Google Hangouts. All of these ways where you can communicate with your friends and family. Do it that way. Do it that way. They should, but also if you have that kind of condition, you should have some sort of medication or something from the doctor as well that will be able to help you explain that to them. But if you get in an instance like that where you go to the store and they don't allow you in and you have pre-existing condition, reach out to us and we'll figure out a way to help you with that as well. Let's see. Any more questions? All right. No other questions? Yes, duos and hold on. Do I foresee a city lockdown? I don't know. There are no evictions right now. Nobody is going to be evicted during this process. So we don't have to worry about that. Do I trust the mail-in process? Listen, I am very concerned, very, very, very concerned about a mail-in only election, but I am also concerned about what would happen if we had a regular election at this time with COVID, and we know that most of our election workers uh, are seniors and they're at the most at risk. We know that we don't want any of them to be put at risk. So what we have to do is have an election that's done in a responsible way. We are going to be making sure that the state and the Board of Elections put protocols and practices in place to make sure that you do not have fraud and abuse of this process. So thank you so much. Listen, again, we don't know how long it's going to last for. Like you, we have to make sure that we listen to the public health advice. We don't know, but what we do know is if we don't take it seriously, we'll end up like Italy and China, right? So that for everyone that's getting impatient and feel like they want to go back to doing what they normally do and want to have parties at their house with all their friends over. Think about what's happened in Italy. Think about what's happened in China. That can happen here if people continue to not heed to the advice of the public health professionals. You can either be uncomfortable for a little while, or you can be in a place where lots more people are dying. Maybe you, maybe your family members. So it's going to be uncomfortable for a while, but we're just going to have to deal with it, and we will make it through it together. Yeah, be responsible. Again, like the shelter in place, I think a really like a thing of semantics. What we need though is, again, is what someone is saying right now, is for people to be responsible. People can get in touch with us simply by sending us a direct message on these platforms, or emailing us at councilpresident@baltimorecity.gov, or calling our office at 410-396-4804. So for the person that says the landlord is selling the house that you're living in, please make sure that you send us a direct message or email us. It really would be preferable if you emailed us about that, so we can make sure that people we can get you helped out and make sure that you're going to be in place and still have a home. So thank you for your question, and shoot us that information as soon as possible. So someone says, should they go grocery shopping with their parents or grandparents? No, you shouldn't. Your grandparents, if they're seniors or people with pre-existing conditions, shouldn't be going grocery shopping at all. You should be doing that for them and dropping it off at their home, and not even taking it inside, letting them come, tell them to come to the door, you put it there, you get it. If your parents are seniors, you shouldn't be doing uh, uh, can't do it that way either. They also should be doing, or they can order it online and have it delivered to them. You cannot go shopping with your grandparents. I actually had this conversation with my grandfather on Thursday to remind him that if he needs groceries, he should call me or order it online from ShopRite. Right, same thing for my grandmother. You should not have them. Can collections still be contacting you at this time? Again, remember, utilities and things like that, they will not be cutting off or calling you, but for other things, what you should do is send us an email or a direct message so we can contact you and let you know. I don't want to air anybody's business out in the public. Again, so water bills. They listen. You're gonna still get your bill, but they're not. We are not doing any turn offs or any shut offs. The tax sale has been pushed back. We know that your taxes being due have been pushed back. You don't have to worry about any of that right now. However, if you can pay it, pay it. But if you can't because you're not working, we know that we're gonna have the people that be able to apply for this new improved unemployment insurance, but they are not turning off people's water or their BGE or anything like that during this crisis. So thank you for that question. Any other questions from anybody? So someone asked the question, when has a liquor store become essential? You have to think about it in a few ways, right? Think about it in a few ways. So, um, in some neighborhoods, the liquor store is also the only place where people can get food and groceries, right? First and foremost. Second, the thing that we can afford to lease right now, what I always say to everybody, what do I say? Unless you have the severe symptoms, don't try to run to the emergency room to get tested, right? Don't try to if you don't have those symptoms and you only have mild symptoms, just call your primary care physician, or if you don't, call 211 and figure out one of the clinics that will help you through that process. But we only want people who have the severe symptoms or people with pre-existing condition rushing to get tested right now, because we cannot afford to have our emergency rooms, our hospitals over drowned with people. If people who drink, and we know that we have a problem with alcoholism in the city, if liquor stores were shut down and they could not get liquor, where do you think that they're going to end up? They're all going to end up in the hospital because they're going to be sick. So you have to think about it from a public health perspective, and also food deserts that don't have access to any other places other than that. Will, what's up, my brother? I miss you too. I'll be back to shooting threes on you in no time. Yes. So again, it's the people who came in direct contact. So if you, just like we did with the firehouse yesterday, folks who come in contact with those people, they are self quarantined. But if you're not, there's a risk assessment done by the health department around who should quarantine and who should not. MTA, the fire department, the police department are all following those. All right. The mayor has put out this thing about having giving people a extra stipend for those who are working here. We know that depending on what union represents you, there's some things going on there. We're going to continue. We are not. I am not involved in labor negotiations. No one on the city council is done involved in them. They only are dealt with by the mayor and his team. But we will continue to press for those people who are, and this is what I do as a former union member myself, continuously advocating on behalf for our union workers to get pay that they're doing hazard pay, especially during a time like this. Yes, Shelly, great thing. If you're sick, take care of yourself. We want you to do that. But if you're feeling like bad, we want people to make sure that that's when you have that tightness in chest, shortness of breath, you're feeling woozy, things like that, you know that you're real bad. We want you to then go to the hospital. A friend of mine who's a state representative in Milwaukee, Wisconsin, a close friend of mine, 33 years old, contracted coronavirus, and he said that it is like some sickness that he's never ever been through before, and he's gonna make it through it. But this is very, very, very seriously. If a first responder has questions about getting tested or something like that, send us a direct message, and also they should also contact their union rep as well. All right. Let's see. It's another question coming in here. So somebody said, "What about crime?" What we want, again, what I always say, that my focus, and this is the focus that I had on with the police department consistently every single day, is about the violent crime that happens in the city. In fact, I'm gonna show you guys. This is what I look at. This is what I look at when I wake up every day. I look at the crime stats in Baltimore City to make sure that I am staying aware of what's happening on the streets in Baltimore, because for me, those aren't just numbers. Those are community members. There are people that we know are suffering. There are people that I know, you know, everyone knows, right? We know we had a shooting in Queensborough one of my friends actually from there on the chat right now, because you never know. No one in Baltimore is immune from this disease of gun violence. So we have two diseases or viruses that we're trying to attack at the same time, and that's where the focus should be right now. Is we have to, the same way that we're dealing with COVID, the same way we have to deal with gun violence. So we have to share the information consistently with everyone. Thanks, my brother. So no, listen, we don't want to even get to a point of that. That's why it's about martial law, these kind of things. We want people to adhere to the advice so that we can remain a civilized society. So they're not saying that they're not like responding to those things essentially. But remember, happening in New York and other places too, right? When you're dealing with something like COVID, what they are saying is they want you to report minor stuff to them online or over the phone, which is actually something that I suggested that they do way back in 2012 so that they can spend more time focusing in on the violence in Baltimore, because we know we get like 1.2 million 911 calls in for police a year, and what they've explained to us is that about 300,000 of those seem to be crimes that no other jurisdiction would have handled in a 911 emergency. So those of us who are in my age range remember when they created 911, it was simply for emergencies. But now we have a lot of crimes, and you can report, and I'm going to give you guys a list of those right now, the things that you can report online, right? It's a great system that we have that allows you to get the same report, like if you need information for an insurance claim when someone damages something or on your property and all of that kind of stuff, we can get all of that stuff online, right? So if you go to baltimorepolice.org, and you can actually file an online police report through a system that I helped get them CopLogic some years ago that we have not. Give me 1 second as I'm waiting for it to open up. So you can report things like illegal dumping, lost property, vandalism, petty theft from a vehicle, vandalism to a property or vehicle. These kind of things that essentially we need reports for so that we can track and try to have the data on where to go and look. No one there. There's no way that they're going to catch that person if these are crimes that are not happening in that exact time, right? So that's the kind of stuff they want you to be people send those reportings online. Someone said, "Why is there a hiring freeze? That the city needs people to fill positions?" So the hiring freeze is for positions that are non-essential. So if the position, then they still can be filled, but everything is not an essential position. So that is the places where we want people to go. So they are testing, and that's why the numbers are fluctuating, right? And look how they have grown, right? And it goes back and forth. 2 days ago we were ahead of Baltimore County, now they're ahead of us. They test consistently. They're going to be expanding testing. We know that the city is frustrated, the state is frustrated, the hospitals are all frustrated. Everyone's frustrated with every state across the country. You can on TV consistently talk about the frustrations of dealing with the federal government and the inability to make sure that more testing is available, and we're all going to continue to press on that. So DPW, stop picking up bulk trash and the other things that you mentioned. That was a direction from the mayor at the behest of the public health professionals, who said that we would be putting those workers in severe risk of contracting COVID. So that is the reason why. But they're still picking up corner trash cans. They're still picking up trash and recycling. All of those things are still happening as well. No, again, remember what I'm saying. If we only want, the testing is available in multiple places across the city, but unless you have the severe symptoms, don't go to the emergency room and try to get tested. only people that have the severe symptoms. That's a great question. What are things we can do while social distancing further out city? A couple things I think you can information on our website again about the volunteer efforts that are going on. There's blood drives. If people feel healthy, they need blood. They're gonna need blood throughout this process. So that is one way that you can help give back. So we're gonna make sure that everyone has that information. Doing the basic stuff too. Checking on your neighbors, your friends, your family, making sure that everyone has this information, keeping people active and all of those kind of things. We want people to make sure that they're getting that information consistently. All right. Well, thank you, everybody. I wanted to say thank you for joining us each and every day. What are the things that you guys are planning to do this weekend as you practice social distancing? Who's having a Zoom call with all of their friends and family? Who's having one of these live parties with a DJ or something like that? What are you guys going to do today and tomorrow throughout this weekend? All right. So stay safe, everybody. Be sure to tune in tomorrow. We will be live again, and make sure that you're practicing physical distancing and enjoy the rest of your Saturday. Stay safe.